Thank you, Dr. Gloria Kim, a great friend. This is a wonderful opportunity today to talk to all of you on a very important, but sometimes being neglected health problems. And because there is actually a very big topic when you talk about evidence-based mental health interventions, with my background, I will focus a little bit more on the non-pharmacological side, and also with the specific issues related to Asians' mental health issues, especially Asian Americans. So I'm going to talk a little bit about the mental health problems. This is an issue that is often being neglected by both developed and developing countries, although there has been an increasing burden over the years. And some of the specific challenges and issues to Asian Americans and Asians, and some of the commonalities, I would say, for issues with regard to mental health in the Asian regions, and also in the US, where there are a lot of Asian Americans, Asian families, and with a specific culture-related issues. I will also talk a little bit about the benefits of providing mental health services in primary care and give you some ideas of some of the more evidence-based interventions, focusing on some of the more non-pharmacological interventions, and also some of that which may be more well-known to Asian Americans. So this is a slide that is that I use from the World Health Organizations and talk about the common mental health disorders. So when we talk about common mental health disorders, we in general refer to two major disorders that include depression and anxiety. Although depression has a higher prevalence in the general population as compared to anxiety, and globally, there's about 4.4% of the global population suffer from depression. And that varies from countries to countries, regions to regions. And there is a chance, or there's a trend actually, that there's increasing number of people suffering from common mental disorders such as depression. And in fact, currently, depression is the leading cause of disability globally. And also by 2030, the WHO expected that depression will be the leading burden of diseases globally. The things about depression is that it is not just about genetics, not just about lifestyle risk factor, but there are other social determinants that has significantly affect the prevalence of depression. That include poverty, unemployment, stressful life events, etc., and also physical illnesses. So this is a figure showing the prevalence of this depressive disorders by the WHO region. You can see that the Western Pacific may have a lower prevalence when compared to the regions of the Americas. But in general, which is very clear from here, that females tend to have a high prevalence of depressive disorders when compared to male. By age and sex, you see that females still are more likely to have a high prevalence of depressive disorders, although there is a slight trend of people increasing in terms of the prevalence till the middle age, and they tend to improve later in life. For anxiety disorders, there are similar trends, although it seems that the region of Americas tends to have a high prevalence, although the overall prevalence of anxiety disorders is lower than that of depression. Now, this is a slide that I really want to show people. It's about the past year prevalence of any mental illness among the US adults. And this figure, which I found from the National Institute of Mental Health from the US, not only showing the gender differences, but also look into the age differences and also differences among ethnic groups. And you can see that the younger population now have a high prevalence of any mental illness in the US in 2020. This is published in 2021. While Asian populations may have a lower prevalence, although we're not sure whether this is related to differences of reporting or stigma associated with being known to have a mental health disorder. So this is a figure that I really want to highlight. And you can see this is a figure on the mental health services received in past year among US adults with any mental illnesses. So this is the health services among people that already have a mental illness. And you can see the Asian populations have the lowest health services utilization, even though they have mental illnesses in the past year in the US, as compared to other ethnic group, with the whites or two other racial groups tends to have a higher services utilization, while the age does not seem to have a very significant impact, and females tend to use health services more. Some of the statistics that I found, although this is a little bit old, but still is quite relevant to the Asian American populations. Among Asian Americans, suicide was the second leading cause of death among the people aged 15 and 34. So it seems to be very affected among the younger Asian American general populations. And among all Asian Americans, those aged 20 to 24 has the highest suicide rate. Among Asian American adults, those aged 18 to 34 had the highest rates of suicide thoughts, intent, and attempts compared to other age groups. So it seems that for the Asian American population, being young and also who are in college may have a higher burden of mental health related problems. What can be the factors associated with suicidal thoughts and attempts among Asian Americans? And this is a complex issue, and I believe that although research has been done, this is a more dynamic, and changes in the environment, in the social context, could also be contributing to differences in the prevalence and incidence of suicidal thoughts or depression among Asian Americans. But we should take particular attention to the social factors, including the family conflicts and also experience of discrimination, which can increase the suicidal thoughts and attempts. And ethnic group identification, including one identification with its own ethnic group, is a protective factors, and strong family cohesion and parental supports are protective factors. Especially strong family cohesion seems to be very important among Asian Americans and Asian in general. And therefore, if you lose that cohesion or if you lose that parental support, then there might be additional risk factors for creating or making higher prevalence of mental health issues. So because of the high prevalence, there are research, or there are a lot of the discussion being done to look into, why does this exist? What's the unique barriers or problems that has been faced by the Asian Americans in terms of the issues. Initially, that's included language, age, gender, etc. But also some of the work has been looking into the Asian traditional values on the family as a unit, with each individual having a specific role and positions. And therefore, if someone is seeking help, there may be more stigma, as the individual health-seeking behavior might impact the whole family unit or the community unit, which can cause shame of the whole family or the collective, the collective community. And there are actually several factors that the researchers have found that may have been related to the underlying underutilization factors. But first of all, in the qualitative studies, they said the Asian family contributions to mental health stigmas, including some of the parents dismissive of mental health concerns. And that is very similar to the article written by written in The Guardian, that's saying that when the adolescents discussed the mental health issues, the parents were focusing on something else and thought that it is a minor issues and did not want to talk about it. So emphasis on saving face. For the Asian community contributions, some of the community will view mental health problems as a taboo subject, and probably they don't want the community to be perceived as having mental health issues and disapprove of burdening the others with problems. And there's also a mismatch of mental health services system with the cultural needs And in this qualitative research, the participants suggested that, intervention models can be more culturally acceptable to the Asian populations, including having a more holistic approach, including some of the other approach that is less medicalized. For example, well-being approach. And in fact, some of the participants commented that they don't want talk therapy. Thinking about paying so much to just talking may not be very cost-effective for them. And also, they also were asking for practitioners who have a dual cultural experience so that they will have the understanding to help them to understand the issues. The women also talk about how they find alternative coping, which is less stigmatizing, including going for the internet to look for information and use of self-help books, which I believe is pretty common for the psychological health, self-help industry to have flourished over the 10 to 20 years. Unfortunately, some of the women also tend to look for substances to numb the pain, including the use of alcohol and other substances to help the pain, including the use of narcotics. So that brings back to why I would advocate for integrating mental health into primary care, because the primary care physicians know the patients very well over time, and the accessibility is much higher with less stigmatizing when people seek mental health services in the primary care settings. They also may be more affordable and cost-effective, and the physicians with a generalist approach can also look at the issues more holistically without being perceived as just addressing the issues as a treatment model. The other benefits of having mental health issues being managed in the primary care settings include the fact that many people who have chronic diseases are also seeing the mental health problems. If they can do it in the same context, that will be much more useful, including the more integrated treatment and the reduction of potential side effects that can be managed in the primary care settings. So go back to the one of the main topics of today. So what are the non-pharmacological interventions that are evidence-based that are relevant or maybe more acceptable to the Asian populations? If you look at any psychological text or most of the publication, including the publication that I co-authored, psychological treatments, mainly cognitive behavioral therapy, now seems to be the mainstreams of evidence-based psychological interventions. So, for example, in Hong Kong, if you have any mental health issues and your psychiatrist or primary care doctors or yourself go directly to seek psychological therapies, then it's very likely that they will use cognitive behavioral therapy. Although this therapy sometimes could be very expensive, and often it takes about 15 to 20 sessions to complete the whole treatments, and each sessions can take up to an hour for each time. So time may be an issue for a lot of people, and many of people, because of that, or the physicians because of that, they will just prescribe antidepressants for people with common mental health disorders. So I'm going to talk a little bit about some of the benefits of using psychological therapies as compared to antidepressants in treating common mental health disorders. There are also a lot of less formal psychological interventions, including counseling, but the less talked about or less discussed are the interventions including exercise, yoga, well, some of the questions about diet and supplements, which is quite common, and some of the things on acupuncture and Qigong and Tai Chi. So just to recap some of the relatively well-known evidence is on cognitive behavior therapy. And in fact, it's been shown over many times. You see that when you collect 57 studies, there are more than 10,000 population, which shows that CBT is effective for depression and anxiety in different settings, including the primary care settings. And they've shown that CBT interventions may be better provided by a non-physician, and that could be the fact that they have more time to deal with that. and many of them are social workers or psychologists, and tends to the fact that delivered in individual sessions tends to be better, especially with motivation interviewing. Now, because of COVID, many people also asked whether the technology-assisted CBT, the things that you can access from the computer for the programs, are equally effective. And it seems that the emergent evidence showing that even technology-assisted CBT can be quite equally effective compared to in-person CBT. So this may be especially relevant to the Asian population where people might not want to seek face-to-face intervention right away and try out something if they're not suicidal, and if there's no other safety issues, and if the symptoms are mild, and that do not affect them significantly functionally or socially for the symptoms. The next I will talk about my favorite subjects is called mindfulness meditations. There are different kinds of mindfulness training, and the well-known one are the mindfulness-based cognitive therapy. So there's this meta-analysis, which is the individual meta-analysis done that collected individual studies data of 9 studies of over 1,000 patients and look at the effectiveness of using mindfulness-based cognitive therapy in prevention of depressive relapse. And in this systematic review, they found that MBCD, the people undergo MBCD has a reduced risk of depressive relapse, with similar to taking antidepressants. So I think this is by far the strongest evidence to show that mindfulness-based cognitive therapy can work quite well for people with recurrent depression, and the effects are very similar to taking antidepressants. So there are other alternative interventions that I want to briefly touch on, including exercise, yoga, acupuncture, and some of the dietary interventions that's maybe more common in the Western society, including St. John's wort, which is available in the pharmacies. And also some of the people or patients sometimes often ask about omega-3 fatty acids. So this, I believe, exercise is such an undervalued intervention for mental health and physical health. We mostly talk about the physical health benefits, including the reduction in cardiovascular disease, diabetes, other physical disorders, chronic pain, etc. But not as many people are talking about exercise as something that can improve our mental well-being. And in fact, large prospective cohort studies have repeatedly shown that people who exercise regularly have a significant reduction of risk of having depressions in the later life. And because this is have a lot of research been done, even randomized control trial have shown exercise is associated with a greater reduction in depressive symptoms with active control, placebo, or new treatments. But what about yoga? And I was looking for, this is published in the British Journal of Sports Medicine in 2021, which is quite recent. And the British Journal of Sports Medicine do publish very good papers. And this study includes 19 studies in the review, and they look into the depressive symptoms change among people with other mental health disorders, and show that yoga can result in greater reduction in depressive symptoms when compared to attention control treatment as usual. What about Tai Chi? Tai Chi is something that is practiced quite regularly among the elder populations. So this is the systematic review done quite recently. I believe this is also published in 2021, showing that Tai Chi in combination with antidepressants may be better compared to just antidepressants alone. But what about acupuncture? Now, acupuncture doesn't seem to have as good an effect for depression, but there are some findings. This one, a meta-analysis, a systematic review, showing that acupuncture may be good for reducing anxiety for people with GAD compared to control groups, although they are calling for more high-quality research to validate these findings. But what about omega-3 or polysaccharide fatty acids? So far, it seems that it doesn't show us to have much evidence, although there are other evidence for omega-3 for your cardiovascular health benefits. I believe that in our life, there will be happy moments and there will be unhappy moments. So how to balance it as a clinicians, as a healthcare providers, as a caregivers, and to know when to refer or when to provide medical cares is really important to it's a really important approach to deal with these emergent important health issues globally. So the take-home message, I think stigma is quite common in Asian population. That doesn't mean that we cannot do anything. There's a lot of things that we can do for them, and primary care may be an approach to increase access to care. And for depression, anxiety, and depressive symptoms, in addition to thinking about the medications, we can also think about things that is more accessible, including some of the non-pharmacological interventions, and some of them which might be more culturally acceptable, such as mindfulness, yoga, or Tai Chi, that might be useful for certain populations. So I need to acknowledge some of the research funding from the Harvard Medical Research Fund and my research collaborators, which from different parts of the world.
Thank you to my dear friend and mentor and colleague, Samuel Wong. Please.
Oh, you are my mentor, Gloria.
No.
You're a good role model for me.
No, you know, I think you've really been wonderful to share all of this, and by understanding what makes people sad, let's hope we can teach people to be happy, because yes, unless we're happy, how can we be healthy? So exactly. Everyone have a wonderful evening or a wonderful day, and please join us again in the future.
And thank you for the invitation again. It's been a great pleasure. Okay. So thank you for meeting all of you. Thank you. Have a good evening.
Okay. Bye, everyone. Bye.